Hey everybody, Dr. John Nunez here with Feldman Physical Therapy. I want to talk a little bit about knee pain, but before we get into that, as always, we really appreciate your support. We love the interest and the engagement we get from all of our clients and friends and fans. So it would really help us out if you wouldn't mind just kind of tapping that subscribe button below, give us a follow. That way we can get more great content out to everybody and we can interact with everybody a little bit more. So we really appreciate that. Tell your friends. Today, talking a little bit about knee pain. All right, so I've talked in the past about why the knee is kind of one of the most commonly involved joints when running during a lot of activity that requires a lot of bending, squatting, jumping, things like that. The knee is a simple hinge. It really just kind of bends and straightens. There's really nothing too much more complicated than that for the knee. I mean, there's a little bit of rotation at the at your shin bone, but for the most part, your knee bends and it straightens. Right. So we're going to talk about for runners some of the more common sites of injury for the knee. Now, these are by no means the only areas that'll get injured for the knee. It's not an exclusive list. So we're just talking about three of the more common areas that are going to get involved. And so if we kind of come a little bit closer here, we take a look at the knee. That's going to be the front of the right knee. Front, the back, side, and side. Okay? So this is going to be the outside of the right knee. This is going to be the inside of the right knee. So where I've kind of drawn three dots directly below the kneecap, just below the kneecap to the outside slightly, and then right here on this bone, the top lateral outside part of the shin bone, which is going to be where the IT band attaches. Now, most people know what the IT band is because we always get that pain in the lateral side of the knee. And if you're a runner, let's face it, 40% of all running injuries come from the knee. Some sort of knee pain is going to be the bane of a lot of runners' existence. And we want to kind of break that down. We want to simplify that for you a little bit. And we're going to demystify knee pain a little bit this week. So that's why I really wanted to talk about this. So again, those three common areas just below the kneecap in the center of the knee, just below that to the outside, and then on the bone at the top of the outside part of your shin bone where that IT band attaches. Now, what you're going to notice is these are all on the tendons. So this is your kneecap right here. If I were to kind of peel this away, this is a great little model here. You have the kneecap on your side, and you have your thigh bone, and you have your shin bone down here. This is that fibula bone on the outside part of your lower leg. So the tendon above the kneecap, we call that the quadriceps tendon. The tendon below the kneecap, we call that the patella tendon. Now what you'll notice is it's the same structure, it's the same continuous piece of tendon, and the only thing that changes is the name based on anatomical location. It's like a highway. When it goes from one state to the next, it changes names completely, even though it's the same continuous stretch of road, right? So same stretch of tendon, we tend to experience pain below the knee more frequently than we do above it for our steady state running, okay? Now the term runner's knee is kind of a garbage term. Knee pain is just a garbage term. It's very broad, very nondescript, and it's all encompassing. It covers all manners of pain of things that we can experience at the knee. Now, if you take a look, this doesn't have the other connective tissue here, right? This doesn't have the muscles. So there's a lot going on here. You have your quadriceps tendon, your patella tendon, you have your patella itself, your thigh bone, your shin bone, your LCL, your MCL, you've got your hamstrings in the back, you've got your meniscus on the inside, ACL, a PCL. So there's a lot of stuff that goes on here, right? There's a lot of things that can become aggravated. But if we're dealing with a non-traumatic injury, right? You didn't slip and fall, you didn't get hit, chances are it's a running related injury where it's more training related and non-traumatic. It's going to happen at one of the tendons. And that's why, for the sake of this talk, I kind of narrowed it down to just 1, 2, 3 areas right there. Okay. Again, we're going to try and demystify knee pain a little bit. Let's keep it nice, streamlined, and neat. I don't like to overcomplicate things. A fun, sexy diagnosis is not always a good one. In fact, I would rather things be simple. I don't want things to be fun and complicated. That just means it's going to be harder to fix. So I look a lot better and a lot smarter to my clients when I can fix it like that, which is why I like simple injuries. And let's face it, common problems happen commonly. So when we're dealing with steady state running, we're going to experience that pain directly in the middle, just below that to the outside, and then laterally even further where your IT band attaches on the outside. Typically, we'll see pain directly at the center of the knee, right below it, with a lot of sprinting and jumping activities. In fact, that's called jumper's knee, right? So if we have runners that are doing let's say track and field, like our high school collegiate athletes doing your triple jump, you're doing your long jump, your broad jump, or even high jump, right? Anything that requires a lot of aggressive knee bending and extending, you're going to get a lot more pain directly at the center of that patella. Okay, so that jumper's knee is typically where we'll see pain directly in the middle. For the majority of us recreational runners, where we're doing our steady state running, if we're not doing a lot of sprinting, not doing a lot of 5Ks, things like that, we'll typically get that pain to the outside portion of that patella tendon, right? So the lateral inferior part of that tendon. So not directly below it, but just to the outside. And typically I'll see patients come in, they'll tell me like, yeah, it's right on the outside of the knee and I can usually put my finger on it, and they usually bend their knee a little bit and kind of rub that outside portion of it. We're looking at that lateral inferior part of that patella tendon right there. That's where most steady state runners are going to experience a repetitive breakdown issue with the patella tendon. Okay, so generally we see that. I consider that one of the more common running injuries. And this is even one of those things that you may be out for a run and you feel it every now and then. It comes and it goes. It's stiff when you start to warm up at the beginning of your run, and then it's better as you run, and then it's stiff when you get out of the car once you get home again. So that's that classic tendon warming effect, where the tendon warms up, gets used to the activity, and then it kind of barks at you a little bit. It pings and it sounds the alarm before and after. Now, we still don't know why that happens. It's a very well documented symptom and case where the tendon warms up and then it gets better and then it gets worse again after the activity subsides. So again, we don't know why that happens. Anybody that tells you they know why, they're full of it, because the research hasn't been able to prove it yet. We know that it just means there's something going on with the tendon. The tendon can't handle that type of activity at 100%, and it takes a little bit of time to desensitize it. That's all it means. It's not like your tendon got any stronger between the time you warmed up or got out of the car and got into the middle of your workout, right? I experienced that when I was growing up a lot. As a young soccer player, a lot of repetitive sprinting over and over and over again, 5, 6, 7 days a week, and I'd be really tight and stiff during warm-ups, and it would, ping at me a little bit, and then I'd be fine. I wouldn't even notice it until after the game, I get home, sit in the car, and getting out of the car, I'm like, oh man, that's smart, right? Even as a high school kid, collegiate kid, that kind of stuff happens. So it's really, really common for runners to experience that type of sensation also, and generally is one of the most common things we'll see, and it points to decreased capacity of the tendon. We'll get to that in a little bit. The third and final spot of what I would consider some of the more common injuries is right where that IT band attaches. Now again, if I come in somewhat close, your shin bone is right here. This little bump on the outside, remember this is the outside of your knee, that's called Gerdy's tubercle. Now, I don't know who that is. It's the person that invented that or found that spot, but thanks to this Gerdy fellow, we know that that's where that IT band attaches, and that's going to be a very common site of knee pain. So even a little bit further to the side and down below, where some runners experience discomfort, not necessarily on the side of the knee, but just below it and a little bit on front. So again, the IT band just facilitates and is present during that repetitive flexing and straightening of the knee. So that's just what we do when we run. It's just repetitive bending and straightening, bending and straightening, bending and straightening. And it's just a lot of repetitive friction there that can cause issues. So again, those are three of the more common sites of discomfort that we'll see at the knee. And I want to go in and unpack them a little bit more as the week goes on. So, we'll probably do some more follow-up videos for this, but ultimately, I just wanted to break this down a little bit, give you guys a little bit of, a lens into what we kind of look at and what we're thinking about, our thought process when we have somebody come in, a runner especially, and we're looking at the knee and it's more of a running related injury. So, that jumper's knee, again, people who are doing a lot of repetitive jumping, explosive movements, sprinting, things like that. Your typical, infrapatellar lateral pain, for the patella tendon. See with people who increase their volume too quickly, people who do a lot of hills, especially downhill. A lot of, if they're trying to incorporate some speed work or sprint work and it's not something they've done in the past, if your volume increases too quickly or your intensity increases too quickly rather than a gradual ramp up, these are ways where we're going to see more common presentations of that lateral inferior patellar pain. So remember, jumper's knee, a lot of repetitive jumping, explosive movements, pain at the lateral infrapatellar pole, so not directly in the center of the patella tendon. You're going to see that with people who do a lot of downhill or people who have changed their volume recently, or if they've done a race, the intensity is kicked up really quickly, things like that. And then a lot of weaknesses at the hip. We're going to see people with that IT band issue, right? Justin did a great video a few weeks back about how to fix your IT band issue. your IT band pain, and it's not something that you can stretch away. In reality, it's more of a weakness at the hip. So as your hip is weak, if your foot hits the ground, you're going to get a collapse of that knee because that's what those muscles are supposed to prevent against. And you're going to get a lot more irritation at that area right there. It just happens to do with anatomically, what that structure's main role is. And so, one of the things we'll do is we'll definitely take a look at people's hips when they do have that pain on the outside part of their knee or their shin, which is, denoting more of an IT band issue. So that's pretty much it for today. Take a look at this model again. I'll bring it in a little closer. 1, 2, 3. A lot of repetitive jumping, a lot of repetitive hills or increased intensity or volume or weakness in the hip. Those are the three main culprits that we see for these type of injuries here. Now, again, before you start saying, hey, wait a minute, what about this? What about that? Yes, there are always exceptions to the rules. But remember, common problems happen commonly. And these are just three of the more common issues we've seen with our runners. It's by no means the only list of things that are going to go wrong with the knee, but let's break it down and cover the most common ones first, right? So if you have any questions, let us know. I'll be putting up some more content regarding this. Take a look at the blog post as well. That's going to accompany this. We'll be throwing up some more exercises that'll go along with this as well. But, it's a really fun topic because it's, my favorite joint to treat. I love treating knee pain, especially in runners and endurance athletes, just because there's so many big, juicy pieces of low-hanging fruit that we get a lot of bang for our buck, right? The juice is worth the squeeze. So that's what we're talking about here. So if you have any questions, let us know. Again, if you appreciate the information, give us a like and a follow below. We really, really appreciate that. We're trying to grow our audience. So that's it. The knee.